Hi, my name is Laura Hickson, and I'm going to provide a instruction slide show for you about your patient care scenarios and symptom analysis that you're going to be doing this semester. So our objectives for these assignments are to help you utilize basic principles, techniques, and tools for physical assessment. So you may not be doing these hands-on, but you'll be observing these techniques and these skills that you'll need for your physical assessment. To recognize and document variations of normal assessment findings to a selected pathophysiological process. And you'll be doing that with your scenarios that you will have for the abdomen, respiratory, cardiac, and neurological systems. Performing a holistic health assessment, including a detailed health history, comprehensive physical assessment, as well as nutritional, physical, psychosocial, cultural, and spiritual dimensions. And you're going to observe this assessment with your videos, but you will also perform one yourself when you do the health history assignment. You are going to interpret and analyze normal and abnormal assessment findings for individuals across the lifespan. And you're going to analyze this information when you do your symptom analysis. Analyzing subjective and objective data to formulate nursing diagnosis. You will use your information that's provided in your scenarios and formulate a priority nursing diagnosis, and you will also do this in your symptom analysis. Use effective communication techniques to perform an assessment on individuals across the lifespan. And you're going to achieve this by doing your own health history assignment and also learning more about this in observing the assessments that are provided in the different systems. Recognizing safety concerns and utilizing evidence-based knowledge in practice. And you will do this by identifying priority assessment findings, priority concerns, and utilizing evidence-based pathophysiology information in order to make clinical judgments. So hopefully this help clears up why it is so important for you to practice doing these patient care scenarios and to complete the symptom analysis, and why the symptom analysis is a signature assignment for the holistic health assessment course. So we are going to meet these objectives by the following. There's going to be 5 total scenarios that must be completed: the health history, abdomen, respiratory, cardiac, and neuro. Each scenario module includes watching the video of the patient assessment, reviewing the chart, and the supplemental data. And then you'll take this information to fill out your assessment form, which I provided you some screenshots of following. Then you're going to submit this into the case scenario assignment, and then you're going to complete the content relating quiz for that week. These assignments make up 8% of your overall course grade. That is how important they are. So once you have gone through and done these 4 scenarios, or even before if you choose, you can select one of these to complete a symptom analysis. So you're going to do this by analyzing the symptoms, the patient concerns, lab values, and vital signs, and to help you to understand how your patient is doing. Is your patient getting better? Are they getting worse? Where are they in their disease process? For example, if a patient has pneumonia as their medical diagnosis when they came into the hospital, and they had a fever of 102 when they came in, but now they have a fever of a 99. From that data, you might anticipate your patient's fever is decreasing. From what you understand about the temperature and things like that, we might anticipate your patient is improving. But there's other data that you might want to concern and look at to help validate your clinical judgment. Maybe it's the x-ray. Maybe it's your white blood count. Maybe it may be some other things like how's your patient feeling? What is their O2 sat? So we're going to look at a lot of this information and start correlating that with nursing diagnosis, patient experience, subjective and subjective data. That is your symptom analysis, and you do it a lot as a nurse. So your symptom analysis itself is 2% of your overall grade. The form and the rubric, I'm giving you screenshots of it in this presentation, but the full form will be released later for you to be able to fill out after exam 1. So we're going to begin with the patient scenario of health history. You're going to watch the video for the health history to give you examples of how to complete this form on either family, friend, or one of your peers in your lab. You're going to utilize the form that's provided and then complete and upload this assignment. So the accuracy of the information is not as important because there's no way I can grade that. You're asking someone else. So it's mainly about you completing the assignment. Every blank should be filled. And if it doesn't apply to that patient, for example, if they're asking about pregnancy and you're talking to a male patient, obviously that is not applicable. But you still need to document. You need to document. There should be no blanks. And I also am going to encourage you, please do not put people's full names on there. We do not want to protect your patient's privacy. So if you didn't document it or you omitted and left a blank, that means that that question wasn't asked, right? If it's not documented, it didn't happen. So be sure to ask every question. And I want you to think when you're doing this assignment, how you might ask some of these more sensitive questions when you're out in the hospital setting. Your communication as a nurse is so important, and building that repertoire with your patient and asking these things respectfully and acknowledging the patient's dignity is very important. So having that communication, and you will see that translate into some of your questions that are asked in Prep U and some of the questions on the exam. What is the most therapeutic discussion you can have with your patients? So let's practice. That's how we're going to practice. Now the next patient scenario is with abdomen, respiratory, cardiac, and neuro. You're going to use a video, the chart, the supplemental findings that are provided, and you're going to complete each assessment form. Then you'll submit your assessment form and then complete your quiz on that week's related content to that chapter. You're going to get some feedback about your submission. If the document's incomplete, you may receive an incomplete for that assignment, but you still need to complete it and resubmit. If you're unclear about any of the content, or if you have any questions about these assignments, I encourage you to ask questions prior to the submission deadline, so that way you can receive a complete for that assignment. So here's an example of this patient assessment form. So you can see the patient initials. We don't use full names here. This information should be provided. Now in the family history, if you don't have the children's ages or illnesses, you could just list unknown. If you don't have their, if they were bed rest in the video and they were not getting up, you can look at the orders, or you can put unknown as well. On this second slide of the physical assessment for this assessment form, you'll see where there's all different body systems that are being addressed here. So be sure to chart these to the best of your ability, and make sure that when you are assessing something that you note the location. If there was the PERLA was not performed, which is your eye exam. If that was not performed, you could list that as not performed. And then the final is this NANDA diagnostic statement. Now, I would tell you that I want you to have a priority diagnostic statement. So it should be related to your the present health concern. That should be the priority. And then lab and diagnostic data. You have some lab to review, and definitely the biggest labs of concern connected to those things, um, abnormal findings, right? And then on your assessment form, the last thing is the risk for Braden scale. And practice filling out the Braden scale. You're going to be doing this consistently in the hospital setting. But I just wanted to give you a snapshot of what your assessment forms are going to look like that are going to go with your scenarios. So here's the symptom analysis, and here's the instructions, and you'll be provided this later on, but I just wanted to introduce it to you so you understand the reasoning behind these assignments. So you'll be selecting one of the scenarios that you've completed. You will use the patient's condition, history, orders, the MAR that's provided, assessment findings, lab and diagnostic data, all the subjective and objective data. And you'll use this data to reach a clinical judgment. So you're going to complete the symptom analysis template with provided information and formulate symptom analysis reflection questions. So again, I did some screenshots of this form, and you'll be provided an actual form at a later date. So here's the symptom analysis, and you'll see if you complete the assessment forms, a lot of that information translates right over to this form, right? So here is some screenshots of this form. And then you'll see, hopefully you're noticing in this template that there's points allotted for each section. So now when we get down to the actual analysis, which is mid-page on that left slide, where it says analysis 50 points total. What is the patient's disease process? Explain where the patient is in their disease process. Are they getting better? Are they getting worse? What would you expect with this patient and their assessment findings? How does the diagnostic data fit with the findings? For example, we talked about the patient with pneumonia. They were febrile. Would that fit with a patient that has a bacterial infection? You might say, yes, that does. You would also want to add the other lab data that you collected. So we're going to talk more about some of these reflection questions, and then you'll see this nursing diagnosis and interventions, nursing interventions, therapeutic interventions, or education you might provide for your patient. We're going to talk more about this as we move through the semester, but I did just want to introduce it to you so you could kind of see what the purpose of some of these things are in your assignments. Thank you very much for watching this presentation, and I'm hoping this helps explain the process for the patient care scenarios and symptom analysis. Thank you.